Hey everybody, it's Jake at Pro in Winchester, Virginia, and today I'd like to talk about communication. Obviously, communication is important for any sort of medical profession, but in PT it's especially important. A lot of times we are the healthcare providers that get the most time with our patients, and this provides us with a very unique opportunity to really get to know them on a personal level, listen to their stories, and kind of learn who they are. And that can be really big for developing patient rapport. It's good for creating a therapeutic environment so that you establish things like trust, confidence, support, things that are really important for a positive rehab experience. The challenging part with communication is that sometimes the things that we say aren't always the things that are received. Communication is a two-way street. It goes between the clinician as well as the patient. We're trying to create a collaborative environment where they both work together and everybody's on the same page. But sometimes our explanations, the word choice that we use, or even our intentions may not get across the way that we want. So let's break that down a little bit. What you say as a clinician may not always be what is heard or interpreted by the patient. I know in my very short career, I've made plenty of mistakes, right? I've said things that I thought would be interpreted one way, and then it wasn't. Things I thought were positive were taken as negatives. When I thought I was doing something that would be well received as a clinician based on my clinical expertise or judgment, it wasn't very helpful for the patient. So what that means is that we should really pay attention to what our patients may be hearing from us, right? We should talk to them and ask them what it is that they understand about this particular intervention or this session, how much they understand about what you're trying to explain. Because a lot of those words can be really big and scary, especially if we're using like some sort of really all-encompassing anatomical or biomechanical diagnosis, or that's what they've been given from a different clinician. And it can just be kind of frustrating and scary because those things just don't seem very accessible. And I think for a lot of us, it can be really challenging, right? Because those are the terms that we use with other clinicians. That's how we speak with, other people in our clinic. Sometimes that biomechanical or anatomical heavy or pathology heavy language is something that's more accessible to us, but we really don't think about how it affects the patients that we work with. Sometimes those things can be scary, and it can be really hard to understand what's trying to be communicated. This can lead to a lack of trust, confusion, or maybe not really fully understanding what your interventions are by the patient, and it can potentially negatively affect your therapeutic relationship or the environment that you're trying to foster. Furthermore, this lack of communication can lead to a misunderstanding of what the client's expectations are and what your expectations are for treatment. Some people really put a lot of emphasis on exercise or manual therapy. And if your style of treatment is slightly different than what your patient's expectations are regarding what treatment should look like, sometimes that can adversely affect how they feel or how they respond to how you treat. And as someone who's really just trying to figure this out as a young clinician, it can be pretty challenging. And I've made that mistake in the past where someone's expectations and my expectations didn't necessarily align, and they had a bad experience. And it wasn't because I did anything wrong or did a bad treatment or anything like that. It was just that my expectations and my patient's expectations weren't necessarily aligned. And it was something that I could have done better on my evaluation to just kind of see what that person expected from care and, how I could have maybe tailored my care to meet those expectations. The other thing to keep in mind too is that even though we're clinicians, we're also human beings. We make mistakes. We try to do the best that we can and be willing to admit that we've made a mistake or that we've created some sort of lapse in communication. It doesn't mean that we don't care or that we aren't trying to actively do the best that we can. It's just sometimes our clinical judgment and our rationale may lead us down a different route. Different clinicians have different ways of approaching stuff, and it doesn't mean that one way is right or wrong. It just means that we have different styles and different skills, and the way that I treat may be very different from Brad or Annetta or Brian, and that's okay. What makes us a really good company is that we find ways to learn from each other and learn from our differences and create something that's very unique and authentic and helps all of our patients. And I think sometimes that can be the challenge because everybody's different, both clinicians and patients. And so that's why it's really important to build a therapeutic environment where we can collaborate with our patient, right? This isn't just an environment where we tell you what to do and you do it. That's not how it works, right? We're trying to build a relationship where we empower you, we help you, find ways to achieve the goals that you have and do it in a way that's helpful and safe and progressively gets you to where you want to be. Now, the challenge with that sometimes is that, again, like my clinical decision making or my interventions may be something that's different than what you're expecting. And so we should be open about those things, both as a clinician, and we should encourage our patients to advocate for themselves and to ask questions. We're never going to put you in a situation that's dangerous, right? But sometimes in rehab, we do things that maybe are a little bit scary or a little bit uncomfortable because we're trying to help you conquer those fears. We always have to keep in mind, our clinical decision-making, our interpretation of what's going on, but also how are patients feeling. One of the things I like to do is ask my patients which exercises they feel are the most beneficial for them. A lot of times I'll choose multiple hip hinges or deadlifts or squats, but let them pick the one that they want because that way they have some ownership in what they're doing. It's an exercise that they like, and it's a way that we can all get what we're looking for, collaborative environment where we're working towards goals, but in a way that doesn't come across as so one-sided. And so it's this collaborative environment that we're looking for. We want clinicians and patients to be comfortable with each other and to trust each other and to be able to work and progress. And we should be able to ask questions and learn and grow and understand. Because getting to know the person that we're working with and understanding what makes them tick and what things are important to them and what their identity is as a human being is all really important. Because we're working with another human being. We're not just working with an ankle or a shoulder or a wrist or an elbow, right? This is a complex human being with all sorts of different emotions and fears and beliefs and understandings that all go into the case that they present to us. At Pro, we want everybody to know that we care about them, that our patients matter, and that we're constantly trying to be better and communicate better and think about things differently so that we can improve as clinicians, so that the care that we provide gets better.